right, great pleasure to introduce Dr. Gloviczki from the Mayo Clinic. Everybody knows Peter. And he's going to talk about what will be the most widely quoted paper in the varicose vein literature going forward, the consensus statement. So, Peter?
Good afternoon. Thank you very much, Jose. And I thank Dr. Veith for including me into the distinguished faculty of this great meeting. We're going to review the recently published guidelines of the Society for Vascular Surgery and the American Venous Forum. Guidelines were needed because our understanding of varicose veins and chronic venous insufficiency has greatly improved in the last decade. Evaluation has been perfected, pathogenesis has been clarified in many areas, and most importantly, treatment has been revolutionized. The guidelines were published in the May issue of the Journal of Vascular Surgery. It's quite lengthy with a large number of references. So in the next 6 minutes and 25 seconds, I'm going to review with you the top 10 guidelines of this document. Number 1, evaluation of patients should include duplex ultrasound scanning of the deep and superficial vein, and this is a strong recommendation with a high level of evidence. Based on the literature, we decided that the duration of reflux should be 500 milliseconds or more in the great saphenous vein, and in the deep veins, the femoral and the popliteal vein, it should be equal or greater than 1 second. The number 2, the SEEP classification, as you heard from the previous talks, should be used to describe not outcome but the severity of venous disease, and the revised venous clinical severity score should be used to assess treatment outcome. Again, this is a 1B recommendation. Number 3, compression therapy is suggested for patients with symptomatic varicose veins. The literature was surprisingly weak to support this recommendation. This was indeed a weak recommendation, and the level of evidence to support it was of low or very low quality. Number 4, the guidelines recommend against compression therapy, and this obviously is a major part of this guideline, as the primary treatment if the patient is a candidate for saphenous vein ablation. Strong recommendation